Hello, my name is Dr. Alan Detton, and in this lecture, I will be going over the muscles of the lower limb with my colleague, Dr. Erin Fillmore. Dr. Fillmore is going to introduce you to the muscles of the gluteal region, and by the end of her lecture, you will be able to identify the major muscles in the gluteal region and list the dominant actions and sources of motor innervation for this part of the lower limb. She will also introduce the muscles of the lower limb and the idea of the compartments within the thigh. I will then continue and list the dominant actions and sources of motor innervation for the muscles within each of these three compartments. I will then continue to explain how you can identify the muscles in each of the three compartments of the leg and list their dominant actions and sources of motor innervation. And lastly, end with identification of some of the key structures in the foot and comparing it to the organizational structure of the hand.
The lower limb is an incredibly interesting and organized part of the body. While your lower limb looks a fair bit different than your upper limb, and distally the lower limb ends in your foot, not a hand, there are an astounding amount of similarities between your upper and lower limbs, even with how the muscles are organized. However, while there are many similarities when comparing the lower limb to the upper limb in terms of bones, joints, and compartments, it is functionally quite different. First, the lower limb primarily functions to support the weight of the body, with a fairly minimal expenditure of energy to do so. Just think of how little energy it takes for you to stand still in one place. Our upper limbs are not designed for weight bearing, and we would tire very quickly if we had to maintain a handstand for a long period of time. Second, the lower limb functions to move our body through space, otherwise known as locomotion. While some people are talented enough to walk on their hands, most of us lack this talent. Now, it is crucial to understand that the way that the muscles of the lower limb are organized are optimized for these two purposes. The gluteal muscles posteriorly, the thigh muscles, leg muscles, and even foot muscles are all optimized to help us bear the weight of our body and to aid in locomotion. For example, muscles in the lower limb often have more bulk and act on joints with much less refined dexterity than the muscles in the upper limb. Functionally, this makes sense, especially when you consider doing something like shooting a basketball into the air. An act that requires that you use your lower limbs to jump high into the air, whilst during the same series of movements, your upper limbs will have the much more delicate task of shooting the basketball towards the narrow hoop you are trying to reach. So let us consider a general introduction to the muscles of the lower limb in the context of what we have just discussed. The lower limb is divided into four regions. First, the gluteal region seen posteriorly. Second, the thigh region. Third, the leg region. And fourth, the foot. These divisions are based on major joints, bones, and surface anatomy landmarks. The gluteal region, if we move posteriorly, is both posterior and lateral, and between the iliac crest of the pelvis and the fold of skin called the gluteal fold that defines the lower limit of the buttocks. This region's muscles are powerful, and while specifics will be discussed shortly, muscles here are responsible for extending the thigh. This is the action you do when you stand up from sitting down in a chair. But they are also responsible for laterally rotating the thigh, abducting, and even medially rotating the thigh. The muscles in the gluteal region are hugely important for assisting in normal walking mechanics as well. They do this by ensuring that our pelvis remains relatively horizontal when one foot is off the ground and half of our pelvis is unsupported by the lower limb during the swing phase of our gait. Now, if we move more anteriorly, remember that the thigh is the region between the anterior structure called the inguinal ligament and the knee. And the posterior thigh is going to be between the gluteal fold and the knee. The thigh's musculature in this region can be divided into three compartments. A medial compartment that is largely responsible for adducting the thigh. Think of adduction as the action required to keep your thighs together as you sit tightly on a horse's saddle. Second, the anterior compartment which is largely responsible for extending the knee and to a more minor extent flexing the hip. Extending the knee and flexing the hip. And thirdly, the posterior compartment, which contains muscles, seen here, that help to extend the hip and flex the knee. Finally, the leg is the region located between the knee and the ankle joint, and like the thigh contains 3 major compartments, each filled with muscle. But this time, instead of an anterior, posterior, and medial compartment as seen in the thigh, the leg contains an anterior, posterior, and lateral compartment, with the posterior compartment of the leg containing most of the muscle bulk and the muscle power. Now, even more distally, we can see the fourth and final region, the foot. Simply recognize now it's an area distal to the ankle joint and crucial for locomotion. The gluteal region is between the iliac crest of the pelvis and inferiorly the fold of skin called the gluteal fold that defines the lower limit of the buttocks. Now, one way in which to think about the gluteal region's musculature is in layers. The muscles can be thought of as being organized into a superficial layer of muscles and a deep layer of muscles, with the deep layer muscles being fully seen only when the superficial muscles are either removed or reflected away. Let us talk about 4 structures important in the superficial gluteal region. The gluteus maximus, the gluteus medius, which you see only the upper part of here, the iliotibial tract, or IT band, and the tensor fasciae lata. The gluteus maximus is a muscle that overlays the hamstring muscles. It is a thick, flat sheet of muscle and is actually the largest muscle in the gluteal region. Gluteus maximus is quadrangular in shape and arises from the back of the ilium, from the side of the sacrum, and from the deeper sacrotuberous ligament, all portions of the bony pelvis. Distally, the upper 3/4 of gluteus maximus inserts and blends into the tendinous thickening of the fascia lata, otherwise known as the iliotibial tract. The lower 1/4 of gluteus maximus passes much more deeply and inserts upon the back of the femur on the bony bump called the gluteal tuberosity, which is part of the proximal superior aspect of the femur. Gluteus maximus works principally to extend the flexed thigh at the hip. Think of this muscle working very hard to help you get up from sitting down in a chair. However, through its insertion into the iliotibial tract, or IT band, which we can see here, it also stabilizes both the hip and the knee joints. So how does it do this? Well, the tensor fasciae lata is a small muscle, a muscle that acts on the knee when the knee is extended. The knee is in full extension when you are standing up straight. This little muscle acts on the knee joint to extend it by acting on the specialized iliotibial or IT band. The iliotibial tract is a longitudinal band of very tough, thick, deep fascia that extends all the way from the ilium of the pelvis, up here, down the lateral side of the thigh, and eventually attaches to the proximal end of the tibia in the leg. This band of tissue is very strong, and it must be, as proximally the fibers of gluteus maximus pull on it as it crosses and acts upon the hip joint, and distally it helps to stabilize the knee joint. Now if we look at gluteus medius, which in this view we see only its upper superior portion, it is a muscle that arises from the uppermost portion of the ilium of the pelvis and inserts upon a large bony proximal bump on the femur called the greater trochanter. This muscle, while deep to glute max, overlies glute minimus and is fan-shaped. Both gluteus medius and the deeper, smaller muscle just mentioned, gluteus minimus, help to abduct the lower limb at the hip. Both gluteus medius and minimus have another very important function. Because their muscle fibers are quite vertically aligned in how they stretch over the hip joint. When these fibers contract, they reduce pelvic drop over the opposite limb during the swing phase of walking. They do this by securing the position of the pelvis on the stance limb or the limb you have planted into the ground. Again, contraction of glute medius and minimus on the stance side, or the side of the body where the foot is planted on the ground when walking, pulls down on the ilium on that same side, and thus raises the opposite side of the pelvis up. This contraction is crucial in order to help keep the pelvis level each time we take a step, and makes it much easier for the opposite foot to move and swing forward through the air without touching or sagging towards the ground. When we consider the deeper areas of the gluteal region, we have to consider a number of very important muscles. In this view, we have removed gluteus maximus and medius and are now looking at a series of posterior, small, deep gluteal muscles. Gluteus minimus is one of the more superior deep muscles we see in the gluteal region. It is fan-shaped, just like the gluteus medius, and originates from the broad wing. As the muscle fibers descend, they converge inferiorly and laterally to form a tendon which inserts onto the greater trochanter of the femur. The same bony bump on the proximal femur where the gluteus medius inserts. This muscle abducts the femur. Now, if we look just inferior to the gluteus minimus, we see another muscle. This muscle is called the piriformis muscle. In Latin, piriformis means pear-shaped, and we can see that this muscle is indeed shaped like a pear. The piriformis muscle stretches from the anterior lateral surface of the sacrum, here, and leaves the pelvis by passing through the greater sciatic notch. This notch creates a foramen when other ligaments, which are not in this picture, are in place. It's an opening that is found in the posterior pelvis. It exits this large foramen along with the sciatic nerve. The sciatic nerve is a very large nerve that supplies most of the lower limb. As the piriformis exits the pelvis across the hip joint posteriorly, it eventually inserts here, high up on the medial aspect of the greater trochanter, just a little bit below and posterior to where gluteus medius and minimus insert. The piriformis is a very important muscle to understand because not only does this muscle act as a powerful lateral rotator of the hip, it is closely related to the sciatic nerve, as both emerge from the pelvis in the same area, and as such, this muscle can sometimes entrap this nerve and cause pain to radiate down the lower limb. Now, if we look at a few of the other deep muscles in the gluteal region, you will notice a number of other short muscles inferior to the piriformis that also arise off the pelvis and insert around the same area on the greater trochanter of the femur. These are the superior and inferior gemellus muscles, with the obturator internus snuggled between the two, and the most inferior muscle of the set, the quadratus femoris. The obturator internus arises from a wide area on the ilium and ischium of the pelvis, and from the obturator membrane, seen here. It is a strong anchoring point, and this muscle leaves the pelvis through the lesser sciatic foramen, which is inferior to the greater sciatic foramen. Remember, the greater was where the piriformis exited the pelvis with the sciatic nerve. As the obturator internus passes around the back of the ischial spine of the pelvis, it makes a turn and is joined above and below by the superior and inferior gemellus muscles. Finally, the last of the short rotator muscles can be seen here, the quadratus femoris. It is four-sided and looks a bit quadrangular in its shape. Quadratus femoris arises from the ischial tuberosity medially and inserts on the femur there. A bony ridge inferior to the greater trochanter called the intertrochanteric crest. Now, all of these short rotator muscles, namely the piriformis, the superior and inferior gemellus, the obturator internus, and quadratus femoris, all pull back on the femur medially. and produce lateral rotation of the hip. Remember, a muscle only pulls when it contracts. It doesn't push. So when a muscle contracts, its length shortens, meaning that the two bony areas that it is attached to get closer together. So when looking at these short muscles of the deep gluteal region, it makes sense that when these muscles shorten, they pull on their more distal bony attachment. And as the muscle belly shortens, these lateral rotators pull on either the greater trochanter or the intertrochanteric crest and brings those bony structures of the femur more medially, thus causing an overall hip rotation laterally. Before we move on to the individual muscles you can find in the thigh, it is important to think about the organization of this region of the body. If you remember from our introduction to the lower limb, the thigh is a region that is divided into 3 distinct compartments by layers of fascia, bone, and ligaments. Each of the major compartments in the thigh shares certain features. Generally, all the muscles found in one compartment have the same general action, they share the same general nerve supply, and even share the same general blood supply. Now, there are a few exceptions to these rules, but thinking about each compartment sharing similar actions and characteristics is a good way to start learning this region. The view we see here is a view of the thigh that we have made a transverse cut through. You are looking up into the thigh from below. Note the bony femur in the center. From this view, you can see 3 compartments. First, the medial compartment, sometimes called the adductor compartment because the actions of the muscles here produce adduction of the hip. Second, you can see the anterior compartment here, sometimes called the extensor compartment because the actions of the muscles here produce extension of the knee. And finally, you can also see the posterior compartment here, sometimes called the flexor compartment because the actions of the muscles here produce flexion of the knee. Now let's review the characteristics of the 3 individual compartments again. First, the medial compartment. Most muscles in the medial compartment act mainly on the hip joint to adduct it. Many of them actually have the word adductor in their name, reminding you of what they do. And nearly all of these muscles in this compartment are innervated by the obturator nerve. Second, we can see the large muscles in the posterior compartment. This is the hamstring group, composed of 3 separate muscle bodies. The hamstrings act on the hip to extend it and act on the knee to flex it. And they're able to do this because they attach to both the pelvis and the bones of the leg. The muscles in this compartment are innervated by the sciatic nerve. Finally, we can see the muscles in the anterior compartment here. This is the quadriceps group, composed of 4 separate muscle bodies. The quadriceps cross the knee to insert on the anterior tibia, so when the muscle belly shortens of this muscle group, it pulls on the tibia and extends the knee. This muscle also has a minor role in hip flexion. All muscles here in this compartment, except the tensor fascia lata, are innervated by the femoral nerve.
The muscles of the anterior compartment of the thigh can be subdivided into 2 groups: those that flex the hip, known as our hip flexors, and the 4 muscles that are grouped as the quadriceps. The quadriceps femoris is a 4-muscle bellied structure. These 4 muscles are readily identifiable if we begin with the first muscle that lies most anteriorly, the rectus femoris. The term rectus means straight, so this is the straight muscle of the thigh. As we can see here, the rectus femoris is going to cross both the hip and the knee. So it's going to produce action at both joints. It is going to help with flexion of the hip and with extension of the knee. So as we look at these different muscles, think about what joint they cross, as that will help you understand what movement it can produce. I've removed a piece of the rectus femoris to better visualize the 3 underlying muscles remaining within the quadriceps group. The first of which is located medially. This is a large muscle, hence its name vastus. The vastus medialis is the most medial of the 4 quadriceps muscles, and it's going to attach on the medial aspect of the patella to help straighten our kneecap during knee extension. The vastus lateralis is its counterpart on the opposite side of the thigh. Here we can see that the vastus lateralis passes immediately deep to the iliotibial tract, or the IT band, which will help you identify this large muscle on the lateral side of the thigh. Sandwiched between the laterally located vastus lateralis and the medially located vastus medialis, we see the vastus intermedius, which again you can now see because of the cut window through the rectus femoris. If I had not cut a piece out of the rectus femoris, we would not be able to visualize the underlying vastus intermedius. Now, the 4 quadriceps muscles are going to share a common distal attachment. The 3 vastus muscles only cross the knee and do not cross the hip. Thus, they're only going to produce action at the knee. How they do this is as a group through their common attachment to the quadriceps tendon. The quadriceps tendon is going to attach along the superior aspect of the patella and then continue down towards our leg as the patellar tendon or ligament. Now, this has both names depending on if you talk to an anatomist or a surgeon. Technically, a tendon is going to attach between a muscle and the bone, while a ligament attaches from bone to bone. So this technically meets both qualifications. It's the continuation of the quadriceps muscles down to the tibia, but it's also the connection between the patella and the tibia. So it technically is both a tendon and a ligament, though they'll often refer to this as a patellar tendon reflex when they're testing the strength of the quadriceps. The second group of muscles in the anterior thigh is known as the hip flexors. So based on the name, you could probably guess the action. The dominant hip flexor is the combination of 2 muscles, the more medially located psoas major muscle and the more laterally located iliacus. As these 2 large muscles pass inferiorly, they go deep to the inguinal ligament. As they do so, the name is going to change to become iliopsoas. So what was once 2 muscles now becomes a single muscle to provide powerful hip flexion. Medial to the iliopsoas, I can see the small medially located pectineus muscle, which is also often categorized as a medial compartment of the thigh muscle because it shares dual innervation, meaning it gets a nerve from the anterior thigh and a nerve from the medial thigh to help it work. The last of the muscles in the thigh is going to produce both hip flexion and knee flexion, and this is the longest muscle in the lower limb, the sartorius muscle. If you were to cross your leg and put the right ankle on your left knee, that's the action of the sartorius. The muscles of the medial compartment of the thigh can be remembered with a useful mnemonic. Great Major League Baseball players. This is going to tell you the order from inferior to superior as we move up and in through the medial thigh. Before we start taking a look at the individual muscles, I want to simply review the action of hip adduction. This is the ability for us, with your legs spread, to pull the thigh back in towards anatomical position. So the muscles here in the medial compartment of the thigh are going to all share this common action of hip adduction, pulling our thigh from a more lateral position back in towards medial position or anatomical position. The first of the muscles that we're going to look at in this sequence is the longest of the group, And this is actually the most medial muscle of the thigh, the gracilis muscle. Now, an easy way to remember the name of this muscle is that there's really only two responses if somebody grabs your inner thigh. You can either say gracias or no gracias. So the gracilis is a long muscle that's going to cross both the hip and the knee. Therefore, it produces adduction of the hip and it's going to produce flexion of the knee. Now, as we start to move up from the great for gracilis, the next muscle we're going to encounter is the adductor magnus. The adductor magnus is a large, powerful muscle of the thigh that takes up a lot of space and is positioned just lateral to the gracilis. As I rotate the thigh around, we can see that the adductor magnus continues superiorly and posteriorly, and it actually has two large portions, a more medially located adductor portion and a more posteriorly located hamstring portion. So this big muscle is going to assist in both adducting my thigh and extending my thigh. As I move more superiorly, the next muscle that I'm going to encounter is the adductor longus. And I've cut it to remove a piece of the adductor longus so that you can see the underlying muscles more clearly. Now, what we're starting to see is that the medial thigh has layers to it. There's going to be two muscles that are more deeply located, the adductor magnus, which is right next to the next adductor, the adductor brevis. So the adductor brevis is more laterally located, the adductor magnus is more medially located. But these two muscles both are positioned deep to or posterior to the overlying adductor longus. So it's pretty important to understand this concept that we go from deep to superficial back to deep in the sequence of great Major League Baseball players. The players is for the last medial compartment muscle, pectineus, which is also going to be part of our anterior thigh because it helps with hip flexion. This small muscle is going to be innervated by the nerves that supply both compartments. In the medial compartment of the thigh, we can see the obturator nerve, which is going to pass from the pelvic cavity into this medial group of muscles. So, if I were to lose the obturator nerve, I would lose the ability to adduct my thigh. So remember, as you look at the medial compartment of the thigh, the simple mnemonic for great Major League Baseball players, to remember gracilis, adductor magnus, adductor longus, adductor brevis, and ending with pectineus. The muscles of the posterior thigh are dominated by a group of three muscles, which are known as the hamstrings. So if you've ever seen a runner pull up short after starting with a sudden burst and grab the back of their thigh, they've likely torn or strained the hamstring muscles. They pulled a hammy. The hamstring muscles are going to consist of three long muscles that are going to cross both the hip and the knee. Thus, they're going to produce action at both of these joints. Let's begin by taking a look at the medial aspect of these muscles, beginning with the large semimembranosus muscle. Now, this muscle gets its name because of its semi or half membrane-like appearance. And if I were to fade the overlying muscle, we could see that this is going to have a broad, flat appearance in cadaveric specimens. Now, the semimembranosus is going to be a muscle crossing both the hip and the knee, and it's going to share a similar function with the overlying semitendinosus, which gets its name because of its half tendon-like appearance. Now, the semitendinosus inferiorly is going to have a much thinner, narrower, and cord-like band of a tendon, which is where it gets its name of half tendon-like. So the semitendinosus and the semimembranosus are both going to pass medially at the knee. These muscles are going to help extend my hip and flex my knee, which is the same action as the last of the three hamstring muscles, the long head of the biceps femoris. What I can see here is that the long head crosses the hip, but it's going to pass laterally at the knee. As its name indicates, the biceps femoris is going to have two heads. So the long head of the biceps femoris is a hamstring muscle, but the other head, the short head of the biceps femoris, does not cross the hip. It only crosses the knee. So this muscle is not a hamstring, even though it's only half of the biceps femoris. So the short head of the biceps femoris is going to help with knee flexion, while the three hamstring muscles, the long head of the biceps femoris, the semitendinosus, and the most medially located semimembranosus, both cross the hip and the knee. The point of attachment for the three hamstring muscles is a roughened part of the ischium known as the ischial tuberosity. So if you've ever sat on somebody's lap and they complained that you had a bony butt, this is what they're feeling, is the ischial tuberosity pressing down on their thigh. The hamstrings, again remember, are going to cross both joints, produce hip extension and knee flexion, while the short head of the biceps only crosses the knee and thus only flexes the knee. Similar to the organizational structure of the thigh, which consisted of three different compartments, each of which shared commonalities with common innervation, common actions, blood supplies, etc., the muscles within the leg are going to be formed into three different compartments that are going to be subdivided by the deep investing fascia and surrounded by the overlying skin. Within this region of the lower limb, between the knee and the ankle, we're going to have the leg. And the difference between what we saw with the cross-sectional cut of the thigh and what we see here is that there's the presence of now two bones, which helps me know that I'm within this region. If I were looking at the thigh, I would have only seen a centrally located femur. When I look at the cross-section of the leg, I can see a more superficially and medially located tibia and a more deeply and laterally located and smaller fibula. These two bones are going to be connected by a piece of connective tissue known as the interosseous membrane. This is a connection, as its name implies, between the bones. Bone being os, inter, between. So interosseous is going to form a tough connection and a joint between the medially located tibia and the laterally located fibula. This concept of where the bones are positioned and the interosseous membrane is going to help you identify the organizational structure here within the leg. If I am positioned anterior to the interosseous membrane, I find myself in the first of the three compartments, the anterior compartment of the leg, which is going to have four muscles. If I go lateral to the fibula, I'm going to find myself in the lateral compartment of the leg, which has two muscles. Posterior to the interosseous membrane and the two bones within the leg, I'm going to find myself within the posterior compartment, which has two groups, a more superficially located group and a more deeply located group. As we look at the muscles and organizational structure of the leg in more detail, it's important to understand this concept that you're going to have common actions produced by a common nerve supplying that group of muscles. So as an overview, we're going to see that there are three different nerves, one each supplying each of these three different compartments. Within the anterior compartment, we're going to see the deep fibular nerve. In the lateral compartment, the superficial fibular nerve. and within the posterior compartment, the tibial nerve. There's also going to be commonalities with blood supply in each of these compartments, as well as actions. Recall that the leg is the portion of our lower limb located between our knee and our ankle. So if I'm referring to the anterior muscles of the leg, it's within this region below my knee and not somewhere else up in my thigh. This group of muscles is going to perform a common action as a group, which is going to be to elevate the top of my foot in an action known as dorsiflexion. Now, flexion is typically reducing the angle between two different regions. In this case, I can elevate the top of my foot and reduce the distance between that surface and the anterior aspect of my leg. So these group of muscles in the anterior compartment of the leg are all going to assist in this action of elevating the top of my foot, known as dorsiflexion. To begin, let's look at a couple of key landmarks. I like to look first for the medially located tibia, and you can see that there's going to be a sharp ridge known as the anterior tibial crest extending down the front of your shin. Now, these muscles are all located on the lateral side of that ridge. They're going to pass down into the top of my foot, but stay in their relationship to the tibia and be in front of it. As they cross the ankle, all of these tendons are going to be positioned between the medial malleolus, the large bony prominence on the medial aspect of my ankle from the tibia, and the more laterally located lateral malleolus, which is going to be the large bony prominence on the lateral side of my ankle, but comes from the fibula. So these four muscles are going to be positioned between the two bumps, the medial malleolus and the lateral malleolus. Beginning with identification of the tibia will help you identify the first of these four muscles, which is named for its relative location to that bone, the tibialis anterior. This long muscle is going to come down and insert on the medial side of my foot. So it's not only going to assist with elevating the top of my foot in an action known as dorsiflexion, but it also helps pull up the inner aspect of my foot in an action known as inversion. If I were to move lateral from the tibialis anterior, the next muscle I would encounter is going to have a tendon that attaches to the great toe or the big toe, known as the hallux. This muscle helps me lift up my big toe. It's known as the extensor hallucis longus. So it's going to not only help me dorsiflex the whole foot, but it's individually going to help you raise your big toe off the floor, extending it. If I continue to move laterally, I'm going to encounter a large muscle that's going to send tendons to the other four toes, or my digits. This muscle is the extensor digitorum longus, and it's going to have four attachments to help you raise each of the other four toes off of the ground. So it's going to again help with dorsiflexion, but also with extension of the other toes. The last muscle is a small muscle that means the third, the fibularis tertius. What we're going to see is that there's two muscles in the lateral compartment of the thigh that relate to this small muscle in relation to the fibula. It's going to attach on the lateral aspect of my foot and help me with eversion, or lifting the side of my foot, as well as dorsiflexion. The lateral compartment of the leg is perhaps the easiest to understand, as it only has two muscles. These two muscles are going to extend posterior to the bony landmark of the lateral malleolus. So they're going to pass between a gap between the lateral malleolus of the fibula and the calcaneus, where we can see the large calcaneal tendon attaching. These two muscles are going to both be named due to their relationship with that bone. Let's first take a look at the more superficial overlying muscle, the fibularis longus. The fibularis longus is going to overlie the underlying fibularis brevis. So the one that is closer to the fibula is the brevis, while the one that is slightly further away from it is the fibularis longus. Now, as these two muscles pass posterior to the lateral malleolus and reach their attachments in the base of the foot, we can see the reason why they get their names. The fibularis brevis is going to terminate or end sooner, while the fibularis longus has a much longer tendon that's going to continue all the way to the medial side of the foot. So what we're going to see is that these two muscles attach to both the lateral and medial sides of the foot, with the fibularis brevis attaching at the base of the fifth metatarsal and the fibularis longus continuing across my foot to the base of the first metatarsal. When these two muscles combine to flex, what's going to happen is they're going to pull the bottom of the foot down and assist with plantar flexion, but they're also going to pull up the side of the foot in an action known as eversion. This is going to elevate the lateral aspect of my foot, and these muscles are assisted by a muscle from the anterior compartment, the fibularis tertius. So we end up having three fibular muscles, the longus, the brevis, and the tertius, all of which assist in elevating the lateral side of the foot. Now, the two muscles in the lateral compartment are also going to assist in pulling the bottom of my foot down, as I mentioned, in the action of plantar flexion. Now, they only really assist this action as the dominant plantar flexors are found in the posterior compartment. To produce these actions, the two muscles, the fibularis longus and fibularis brevis, share a common innervation. This is going to be from a nerve that splits off of the common fibular nerve. Now, the common means it's going to split. So common fibular is going to split into two components, a more laterally located superficial fibular nerve and a more anterior located deep fibular nerve. These two branches of the common fibular nerve are going to supply the anterior and lateral compartments of the leg. The superficial fibular nerve is going to supply this lateral compartment, while the deep fibular nerve innervated the anterior compartment. So compression or injury at the back of the knee, damaging the common fibular nerve, could produce damaging results in both the lateral and anterior compartments of the leg. The posterior compartment of the leg can be subdivided into two different groups, a superficial group and a deep group. We'll begin by taking a closer look first at the superficial group of muscles and the structures in this area. To begin, let's look posteriorly at our heel, where we can identify the calcaneus, the prominent bone in the back of our foot. Attaching to the calcaneus, we can see the calcaneal tendon, a large, strong attachment for the superficial compartment muscles. As a result, these muscles are all going to share a common point of attachment, which means that they're going to share a common action at the ankle. The most superficial and posteriorly located of these muscles is a muscle known as the gastrocnemius. This muscle has two portions, a medial head and a lateral head. As we can see, the muscle is going to cross the knee joint as well. So it's not only going to join with its attachment at the calcaneal tendon to produce action at the ankle, but it's going to produce action at the knee. To help you remember the action of the gastrocnemius, I want you to think of this as the scooching muscle. If you've ever been sitting down in a chair and you need to scooch forward or pull your chair forward, you're going to feel your calf, this posterior muscle, tighten up. So the gastrocnemius is going to cross the knee and assist in knee flexion. It's also going to help stabilize your knee when you are plantar flexed. Really closely associated to the gastrocnemius, and in fact to visualize it I've needed to cut one of the heads of the gastrocnemius, I can see the underlying plantaris muscle. I like to think of this muscle as helping you plant your foot. So the plantaris muscle is going to have a really long, thin tendon that is also going to attach to the calcaneus. So this small muscle is going to help with plantar flexion, and it's located right behind or posterior to my knee on the lateral aspect. Positioned deep to the gastrocnemius on both the medial and the lateral side of my leg is the large soleus muscle. Now, in order to better see the soleus muscle, I'm going to hide the overlying gastrocnemius muscle so you can see the size and expanse of this large muscle. The soleus got its name because it looked like a filleted fish, the sole fish. And the soleus is going to share a large attachment with the calcaneus to the calcaneal tendon and the calcaneal heel bone. Now when these muscles contract, it's going to produce plantar flexion. So the soleus is only going to produce plantar flexion because it does not cross the knee. So you can see that it is assisted by the gastrocnemius. Now the gastrocnemius tends to get all the credit because it's more superficial and more identifiable, but the dominant plantar flexor at our ankle is actually the soleus muscle because this large powerful muscle can only produce plantar flexion, while the gastrocnemius was also concerned with scooching or flexing our knee and stabilizing the knee when we are in a fully plantar flexed position or in tiptoe. The posterior compartment of the leg had two different portions. The superficial compartment, which consisted of the gastrocnemius with its medial and lateral heads, the plantaris, and the soleus. Let's now take a closer look at the deep group of muscles within this posterior compartment by hiding and fading the superficial group. So here we can see the faded soleus, which would cover up and overlay all of these muscles within the posterior compartment of the leg in the deep group. Again, for orientation, it helps to begin with identification of the calcaneal tendon attaching to the calcaneus, the posterior aspect of our heel. It also helps for orientation to identify the medial malleolus, the inferior distal continuation of the tibia. We can see that the tendons within this deep compartment are going to pass between the medial malleolus and the calcaneus. So we're going to see the three different tendons extending from the deep compartment of the leg into the sole of our foot, again between the medial malleolus and the calcaneus. The first of these is going to be positioned as close to the tibia as we can when we pass behind the ankle. This is the tibialis posterior. The tibialis posterior is going to attach on the medial aspect of the foot to produce the action of plantar flexion. Really close to the tibialis posterior, and in fact overlying the majority of its muscle belly, we can see the flexor digitorum longus. Now, as its name implies, it is going to flex the digits or our toes and have a long tendon. As we pass posterior to the medial malleolus and cross into the foot, we can see the tendon of this muscle branching and splitting to the four lateral toes or digits. So the flexor digitorum longus is not only going to assist in plantar flexion, but it's also going to assist in flexing of our actual toes, or curling them down towards the plantar surface of our foot. If we were to go lateral to where we saw the tibialis posterior and the flexor digitorum longus, we see the last of the muscles within the deep compartment of the leg, the flexor hallucis longus. The flexor hallucis longus is positioned deep to the calcaneal tendon, and it is often difficult to see in dissection due to this deep location where it passes posterior to the ankle joint. As its name implies, the flexor hallucis longus is going to flex our hallux, or the big toe, and has a long tendon. So as we look at the sole of the foot and we identify the tendon of this muscle, we can see that it's going to continue all the way down towards the distal end of my big toe. Again, as it's going to contract or produce movement, it will assist in flexion of the great toe. So the flexor digitorum longus is going to flex my 4 digits, while the flexor hallucis longus is going to focus on flexing of the big toe. As a group, these deep compartment muscles are going to assist in the action of plantar flexion with the superficial group. All of these muscles in the posterior compartment of the leg are going to share a common innervation by the tibial nerve. So we're going to see that behind the knee, this nerve, the tibial nerve, is going to descend into the posterior compartment of the leg, where it's now going to be able to provide motor innervation to both the superficial group of muscles and the deep group of muscles. The foot is the inferiormost aspect of our lower limb, and it's specially designed to assist in walking around and supporting the weight of our body. So although it bears some semblance to the hand in that it can have an action of both flexion and extension of the digits, it's going to have some very specific adaptations and unique differences as compared to the hand. One thing I do want to highlight is that we see here a faded portion of the extensor retinaculum. Note how this fibrous piece of connective tissue helps hold down the different tendons passing into the foot. This concept is quite important as it's going to allow for more efficient contraction of muscles positioned higher up in the leg. So as the muscles within the leg contract, it's going to produce motion in the foot around the ankle joint. And how this is done is by holding down the tendons tight up against the bones by these retinacula. If I didn't have the retinacula and the muscle were to contract, all that would happen would be the muscle would bow out directly from its point of origin to its point of insertion. So these are going to act like a pulley to hold down the tendons and allow for more efficient motion within the foot. Now, a difference between the hand and the foot is that we're also going to have muscles within the dorsum of the foot, where we did not see that in the hand. On the dorsal aspect of the foot, I do have small muscles that will elicit direct action. The more medially located of the two is going to go directly to the big toe, but it has a shorter length than its longer counterpart that extends from the anterior leg. This is the extensor hallucis brevis muscle. On the lateral aspect of the foot, I'm also going to see the muscle belly of the extensor digitorum brevis muscle, which is going to send 4 tendons to the other 4 digits. These 2 small muscles are going to assist in the stronger, larger actions from the muscles in the anterior leg, the extensor hallucis longus and the extensor digitorum longus. So that is a key difference between the foot and the hand in that I do have small muscles within the dorsum of the foot. Now on the plantar surface or the sole of the foot, we're we're going to only look at the first layer of muscles within this region. The foot is quite complex and has 4 different layers of tissue. The first actual layer is made up of a tough, fibrous piece of connective tissue known as the plantar aponeurosis. So if you've ever heard of somebody getting plantar fascia, or fasciitis, I should say, it's due to inflammation of this tough piece of tissue. Now, deep to the plantar aponeurosis, which has been cut, we can see the underlying flexor digitorum brevis, which is going to extend from the calcaneus posteriorly to each of the toes anteriorly. This small muscle is going to reside in the first layer of the sole of the foot and assist in curling our toes with the flexor digitorum longus. Now, to either side of the flexor digitorum brevis, we're going to see 2 muscles that help pull my toes out away from the midline. There's going to be, on the medial side of the foot, an AB, or abductor hallucis, and on the lateral side of my foot, an AB, or abductor digiti minimi. So I'm going to have a small muscle that helps pull my little toe out to help stabilize my foot when walking, and a small muscle that is going to help pull my big toe out while walking to again help stabilize the foot. So with a broader surface area, we're going to be able to have more balance and better ability to walk and move around.